Welcome back to the Up North Trail Boss YouTube page. This is going to be part one of a multi-part series of Overland medical care and Overland first aid. So I encourage you to watch as many of these as possible. This is going to be just a brief overview of a bunch of different topics, just to kind of give you that basic knowledge. And then each week, I'm going to plan on going way more in depth on these and try to get some more video and actually show stuff. But I want to have just this brief overview today just to give you a good starting point. A little bit about me. My experience, I was in the Army Reserves for 6 years, where I did function as my unit's medic for a while. I've been a paramedic for about 3 years, and I was an EMT for a couple of years before that. I've been a firefighter for about 5 years now, and recently I got accepted into PA school. I tell you that not to brag or anything like that, but to show you that I do have a decent amount of knowledge in this, some experience maybe to go along with that, and it's something that I'm very passionate about. So this is something that I don't want anybody to ever have to use this. I don't want to see anybody get hurt, but I know this is something that can potentially happen, especially way back in the woods or way back off the beaten path. So it may just be you and some friends, and this is something that could easily save your life someday. Disclaimer, a couple things here. This is just going to be a basic overview. This series is not meant for anything more than that. No one's going to get their MD or anything like that from watching this, but hopefully to give you just some basic knowledge to hopefully save a life someday. It's obviously more complex than I'm going to be able to show in a YouTube series, but this will be a good starting point. There's a bunch of great classes out there that I'd love for you to try to find, get some good hands-on experience, and we'll talk about that later on. Today, there's not going to be any real blood or graphic content. I do have a couple medical diagrams, but nothing that should make you too queasy if you don't like blood. So as some general overview, general rules of thumb, don't make anything worse. If someone's got something that's stabbed into them, a knife, a tree branch, something like that, leave it in place. If you pull that out, that could have been inside of a blood vessel. And when you pull it out, the bleeding could get much, much worse. So anytime like that, just take a deep breath, see what's going on in the situation, make sure you have as many pieces of that picture as possible and make the best decision in that time. Also, humans are really, really good at knowing what's normal. You can look at your friend and say that, wow, your skin color doesn't look like it usually does. You're feeling all right. Same thing. If you see somebody that's laying on a park bench, we know pretty instantly whether they look kind of normal and they're sleeping, or if it looks like something bad's going on. They're not breathing right or something like that. So if it doesn't look normal, there's a good chance it isn't. Trust your instincts. And when in doubt, seek medical care. You could have the best trauma surgeon in the world out on the trail with you, but if they don't have the right equipment, they don't have a surgery suite and everything that goes with that, they're not going to be much help. So sometimes the best thing you can do is just load them up and get going towards that hospital. I realize that a lot of times we could be potentially hours or more from a hospital. So sometimes the best thing is just get moving as soon as possible. So the first thing we're going to talk about is hemorrhage, which is a fancy term for bleeding. We're going to go much more in depth in the coming weeks on this, but here's a brief overview. You can see all of the blood vessels. These are a lot of the main ones. There's more than this in the body, but it gives you a good idea of just how many blood vessels there are in your body. And some of these are very close to the surface. You can look at your arm and see some of them, and that just gives you a good idea of just how close this could be. The arteries are red. These carry oxygenated blood, and they're much higher pressure than the veins. If you have an arterial injury, there's a good chance it's going to be almost like spurting out of the wound. As you can imagine, that's going to cause you to bleed out much faster. Venous is lower pressure, and that's the unoxygenated blood going back to the heart and lungs. Injuries to this are usually oozing, but there are some very, very large veins, and it's still possible to bleed out from these. So just because it's not spurting doesn't mean that it's not serious. So some basic treatments here. The first thing we want to do is remove clothing, expose that injury. Think of a big bulky sweatshirt or a jacket or something like that could easily absorb a bunch of blood, and it's kind of hard to tell what's going on and actually see what's injured. So the first thing you want to do is direct pressure. Ideally, if you have medical gloves, you could take that and some gauze and put pressure right on the wound. If you ever had a small wound, you just kind of put pressure on it, it stops bleeding. That's the whole idea here, is just to put pressure there and let the body naturally clot like it's supposed to. Other things you can use are pressure dressings. That's the bandage on the top of the screen there in the center. These are commercially designed, and all they do is just put pressure on there so you don't have to hold it. And There's a couple different names for these, but these are really helpful for this kind of stuff. Wound packing is another thing. And the basic idea is you're just going to take sterile gauze and push them down into that wound. And you're trying to get pressure on that blood vessel from those gauze. This would be something that I would highly recommend taking like a Stop the Bleed class or something like that. They'll go a lot further in depth of how to actually do this. And then you can practice it on a mannequin to make sure you're doing it right. Tourniquet, there's one type shown there on the bottom. That is the CAT tourniquet. That's what the military uses for the most part. Basically, a tourniquet is going to compress an artery and stop the blood flows to stop the bleeding. You want to put that above the injury, so closer to the heart, and you want to tighten that as much as you can until the bleeding stops. Once you put that on, don't take it off. It used to be as soon as you put it on that they were going to lose that arm. Not the case now. I've heard 6 to 10 hours or more you can have a tourniquet on before they have to lose that part of their arm or leg or whatever you put it on. Big thing is not to rely on improvised medical equipment or tampons or anything like that. Us overlanders spend tons of money upgrading our vehicles and getting fridges and rooftop tents and all this other stuff. And you can get decent medical gear for not that much money. A good tourniquet like the CAT shown here is about $40. I would highly recommend not getting cheap things off of Amazon. I guess if you trust cheap knockoff things made in China to save your life, that's up to you. But I would highly recommend getting a kit from a well-known, respected source like that. We'll talk about that a little bit later on today. Next is musculoskeletal injuries. These are going to be muscles or joints, or this could even be like a sprained ankle or something like that. So what you're going to want to do is, if you have a broken bone, there's a good chance you're going to know where it is, or even if it's just if the middle of their forearm hurts, you can use anything to splint that, anything that's hard that's going to support that. Some things here, this is a commercial splint called the Sam splint, rolls up like this. It's perfect for these kinds of things. And then you're going to wrap above and below the injury to help support that. If you have a stick, you can take and wrap some sort of bandage. This is the ACE bandage here. There's all kinds of, this is Curlex. ACE bandage, Curlex, things like that work really well. But you want to make sure that it's loose enough that you're not causing a tourniquet or anything like that. So it should be loose enough that they're still able to get blood flow. But again, above and below the injury, and something that's rigid enough to support that injury. Heat emergencies. This is a big one in the summertime. Basically, you're going to want to cool them down. You can see here the difference between heat exhaustion and heat stroke. You can pause the video, read through that a little bit more. The big thing, heat stroke, they can die, and they can die quickly from this. So you want to call 911, and you need to move very quickly. So heat exhaustion, you're just going to move them to a cool place, shaded, maybe into a vehicle with air conditioning on, rest, and make sure they rehydrate. Heat stroke, like I said, medical emergency. You need to begin active cooling, fans, misting, cold packs in the groin and the armpits. If you have blankets you can get cold or wet, put those on them. You want to make sure you're not making someone shiver though. So once you got to be careful with ice packs and things like that. And then cold injury, so you don't want to cause frostbite if you're dunking them in a chest full of ice or something like that for a long period of time to cool them down. So like I said, don't make things worse, but get them cooled down very quickly to avoid life-threatening permanent damage from this. And then burns kind of go in this. We were always running campfires and propane, this, that, and the other thing, hot vehicles. So the first thing you want to do is stop the burning process. So get them out of the fire, get them off of the whatever. Clothing could still be on fire, get that cooled down. If they have jewelry, metal holds heat for a long time, make sure you get that off. If clothing is melted into the wound, don't pull it out, just kind of cut around that if you can. And then you want to cover them with sterile gauze. Make sure it's dry. You don't want, as we were talking about with heat strokes, cover them with wet blankets. It helps get rid of some of that heat. Well, burns, you don't want to do that. So you want it to be nice and just dry and as clean as you can get to cover that. Moving on to cold emergencies. Not as big a thing with overlanding, but with all the diesel heaters and everything now, this is going to become much more common, I believe. So frostbite if you haven't seen that, you could Google it. I wouldn't recommend that if you've got a queasy stomach though. So frostbite, you want to slowly rewarm it. Do not rub it. That can cause permanent damage. Frostbite is actually the cells kind of start to freeze. So if you rub it, you could break those cells open and cause a lot of problems there. So slowly warm them up, bring them into a warm area, kind of, warm by the fire. Make sure you take off any clothes that are wet. If you're out in the woods and you can't get rewarmed or anything like that, wet stuff, it pulls heat away and evaporates really quickly. So you want to make sure that you are avoiding wet clothes if at all possible. Hypothermia, this is a low body temperature. So you want to passively warm them, but make sure that they're not going to get cold again, because it's hard on the body if you get really cold and then warm up and then really cold. The same thing with frostbite. So things that would be good here: warm blankets, heat pack in the groin and the armpits. You get a lot of blood flow through there. And then warm ambient air. Just sit them in a truck with the heater running to warm them up. Again, careful you don't cause burns. We want to make sure that we're not putting something on them that's too hot. And so you got to remember that they could be numb or even unconscious from this. So they may not be able to tell you if something is too hot. So just be really careful with that. Some common medications. I'm by no means telling you to take these, just kind of explaining them. NSAIDs are one class of medication. Those are things like Motrin and Aleve. These are good painkillers. They also help with inflammation, which is swelling. Tylenol is also another good painkiller. Kind of works similarly, but a little bit, it's a different type of painkiller. Benadryl is something you can take for allergic reactions. These are all sold over the counter. So Benadryl isn't going to be that helpful for anaphylaxis or where your airway's swelling shut. But if you find out that you're allergic to some sort of whatever that you have and you start getting hives or a rash on your skin, that would be something you could take there. Baby aspirin, also chewable aspirin, they're the same thing basically. And that's good for someone who starts having chest pain. This is what the doctors will give. You've heard the commercial for Bear aspirin that saves somebody's life. That's what it is. And it helps the blood to not stick together and cause clots as much, which is helpful if someone has a clot forming in their heart. And antibiotics, a common one you'll see is Neosporin, something you can put in if you have a wound. It helps clear that out. Make sure you don't save any pills, though. If you get put on antibiotics for pneumonia or some other disease like that, make sure you take every single one of those. Don't save it for your overland trip coming up in case you get into something. That's how superbugs are formed, so we don't want to do that. But again, these are over-the-counter things that you can consider to take with you. A lot of it's going to depend on who you're going with. And here's some recommendations for what to look for in a med kit. So we'll start on the left side. This is stuff that I think everybody should carry. At least one tourniquet. I would recommend multiple tourniquets per person. They're not that expensive and they could definitely save your life. Rolled gauze is another one. This is very helpful. And it's just gauze that's rolled up. Pretty simple. If you just Google it, you'll see different things there. You can even get this at the local supermarket from a trusted brand. I would say would be pretty good there. Pressure bandages. We saw that earlier. Those are good to carry. Kind of have a similar function as the rolled gauze, but you're able to put direct pressure onto someone's wound this way. 4x4 and 2x2 gauze. Again, you can find this at the supermarket. These are just cotton gauze pads you can cover up a wound with. Ace wrap is helpful. If you put a 4x4 over a wound, you can cover it with the ace wrap. That's that kind of stretchy band that you can put around. It's also good if you say have a dislocated shoulder or something, you can make a sling out of that. Sam splint was that orange splint we saw earlier, or other splinting supplies. This is something pretty easy to carry with you. Trauma shears, so just medical scissors, basically helpful for cutting clothes and band-aids and things like that. A little bit more robust than a normal pair of scissors, and they're specially designed so they don't cut the skin. Ice packs and heat packs would be definitely good to carry. They've got multiple different uses, and depending on where you're going, you could take a couple of each. Medications, so this could be some of the ones we just looked at, or if you or someone in your group takes medications, I would highly recommend taking at least enough for your trip and plan ahead in case something bad happens. And then tape would be very helpful, especially just, if you put a Band-Aid on, you can tape around it. We're out in the woods, we all know if you put a Band-Aid on, it always falls off. So tape, different sizes just to hold things in place. Other things, if you've had the training or you've gone through a class, that I would recommend a pulse oximeter. That's going to be helpful for an assessment. Blood pressure cuff, stethoscope, OPAs or NPAs. Those are devices used to open up an airway. AED, we all saw, I'm sure most people have seen the NFL. They had that player that went down. The AED is what saved his life. So especially way out in the woods, way out off a trail, wherever you are, Unless you're able to get them to the hospital within minutes, an AED could definitely save someone's life. Now, they're expensive, kind of hard to carry, so that may not be practical, but if you're looking for the best med kit out there, I would highly recommend an AED. BVM is used to give breath to someone. In CPR classes, we don't really teach mouth to mouth anymore, but a BVM is something you could use there. But again, if you don't know how to use it, I wouldn't recommend it. And a glucometer, especially if you're going with someone who's diabetic, could be very helpful to figure out what their blood sugar is or things like that. On that note, if you're with somebody that's diabetic, a lot of people nowadays have readers. It's a little thing in their arm, and you check it with your phone. So talk to them if they have that. Try to get the app, and if they start acting weird, you could check that and see what their blood sugar is. It might be getting low on them. And like I said, some medical classes that I think everybody should look for and take: CPR and AED. That's a fairly short class, super helpful information, not just for overlanding, but for anything. Definitely can save a life that way. Basic first aid, a lot of times you'll see CPR and first aid taught together. And this is a lot of the stuff that I talked about here in this class, but they'll do a hands-on portion and actually let you touch, feel, have mannequins practice that kind of stuff. Stop the bleed is the same way. That's through the American College of Surgeons, and they teach you how to stop major bleeding. That's a very good class, and it doesn't take that long. If you're looking to step it up a little bit, Wilderness First Responder would be a good class. It's focusing on things, medical treatments based in the wilderness. That would be a really good class. And then emergency medical responder and emergency medical technician are even higher than that, but would be awesome, especially if you are going somewhere way off the beaten path by yourself, to know what to do, or in a group, something like that. If you're looking for some of these classes, you're not sure where to go, I would recommend you could stop into either your local hospital or local EMS or fire department. A lot of times they're going to know classes going on in the area or point you in the right direction. Or if you have some equipment that you got online but you're not sure how to use it, stop in. If they're able to, I'm sure they would love to show you how to use that the proper way. So that's the end of part one. I encourage you to keep checking back. I'm going to be posting things weekly here to try to come up with the best medical training with the overland, even backpacking, anything like that in mind. So let me know in the comments down below what you really want to see, and I'll work to get that incorporated. And like, comment, subscribe. It really helps to grow the channel. Share this with anybody you know that needs to learn what to do in a medical emergency, especially back in the woods, back up on the trail. I keep saying woods because that's all around me, but I guess this could be on a trail, on the rocks, wherever you are. Hopefully you don't have to use this, but it could definitely save someone's life someday. Thanks for watching.